Pharmacy Pearls, drug therapy that works.
In this episode of Pharmacy Pearls, I'm going to tell you about a medication that may treat high blood pressure and gout all at the same time. First, the background. Allopurinol is the most commonly prescribed medication for the long-term prevention of recurrent gout attacks. It works to lower blood uric acid levels by blocking its production. In the management of chronic gout, the aim of therapy is to treat to a target blood uric acid level, as defined for the individual patient. The minimum target is less than 360 micromoles per liter, which is the saturation point for uric acid in the extracellular fluid. In some patients, such as those with advanced gout, a target of less than 300 micromoles per liter is required to improve signs and symptoms. Regardless of the specific target, people should start low and go slow when beginning allopurinol. For instance, the starting dose should not exceed 100 milligrams per day in any patient, and it should be gradually increased every 2 to 5 weeks until the target blood uric acid level is reached, up to a maximum daily dose of 800 milligrams. With that being said, the majority of prescriptions for allopurinol are for doses of 300 milligrams per day or less, and more than half of these patients do not achieve their target. Why is allopurinol regularly underdosed? The primary reason is that many clinicians will adjust the dose to the patient's kidney function in order to avoid a rare but potentially life-threatening allergic reaction called allopurinol hypersensitivity syndrome. In addition, up to 1 in 20 people stop the medication due to common side effects such as acute gout flares at the beginning of treatment, diarrhea, nausea, skin rash, or elevated liver enzymes. Therein lies a potential clinical opportunity. If most patients do not reach target on allopurinol alone, can we make it work better by adding on other medications that also lower uric acid? As it turns out, we can. High blood pressure and gout often go hand in hand. In fact, according to the 2005 Health Professionals Follow-Up Study, people with high blood pressure are 2.3 times more likely to develop gout. Additionally, 3 in 10 people with high uric acid levels or gout also have high blood pressure. Losartan is a drug commonly used to treat high blood pressure. It belongs to a family of medications called angiotensin II receptor blockers. It has also been shown to uniquely act on the kidneys to promote the excretion of uric acid. Additionally, it changes urine pH levels, helping to prevent uric acid kidney stones from forming in the process. The uric acid lowering effect of Losartan has been demonstrated in at least 2 prospective, randomized, blinded studies. In the first study, published in the Journal of Hypertension in 2001, after a 3-week run-in period with enalapril, treatment with Losartan for 8 weeks resulted in a statistically significant reduction in blood uric acid levels in the range of 10 to 20%. By comparison, irbesartan, a member of the same class, had no effect on blood uric acid levels. In this study, increasing the Losartan dose from 50 milligrams once a day to twice daily did not further lower uric acid. In the second study, published in the Journal of Human Hypertension in 2006 and conducted in China, 8 weeks of treatment with Losartan reduced baseline blood uric acid levels by about 15% and resulted in a statistically significant decrease compared to treatment with irbesartan. To summarize, high blood pressure and gout often coexist. Losartan is an effective treatment for high blood pressure and also significantly lowers blood uric acid levels. It can be started at a dose of 50 milligrams daily and increased to 100 milligrams if needed. It is well tolerated and does not increase the risk of kidney stones. The studies do leave some unanswered questions. First of all, while Losartan lowers uric acid levels anywhere from 10 to 20%, we do not know if this effect is clinically significant. Specifically, we do not know if it actually prevents gout attacks. Additionally, we do not know if starting Losartan increases the risk of acute gout flares, as is the case when starting allopurinol. Finally, we do not know if these results are applicable to the average patient with gout, as the studies were small, of short duration, and none of the enrolled patients were also given allopurinol along with Losartan. Thanks for watching. If you enjoyed this Pharmacy Pearl, please hit like and subscribe to my YouTube channel.